Hi, Annan.
Hi.
And what is all this about today?
Today is the World Sepsis Day, which is 13th September of every year. So, and me and my colleagues, as we work as acute intervention team, so we do see sick patients, and we deal a lot with patients who have sepsis or septicemia. So it's basically infection that it does go to a worse stage. So we're increasing the awareness for the nurses, doctors, all employees, even for people who visit from outside, on what is actually sepsis, what does cause sepsis, and how we treat sepsis.
And how serious is it? Can you die from it?
Yes, actually, in fact, septicemia or sepsis is the second most cause of death in UK after heart disease. Yeah, so it's very serious.
And how do you treat it?
We treat it with antibiotics, with fluids, with oxygen, with regular blood observation, with regular blood tests, with blood culture and knowing what's the right antibiotics for the patients. If that's at the beginning sort the patient out, that's great. If it did not work, then the patient might be admitted to the high dependency unit or intensive care unit, where sometimes, unfortunately, the patients might need some ventilation assistant, like to be on mechanical ventilator, or he needs some inotropes, which is drugs that help us increase the blood pressure, increase the cardiac output. If patients reach that stage, then it is serious. So it is very serious. But the most important thing is to start treatment within the first hour of diagnosing the patient with septicemia. That's the most important thing. Within 1 hour.
Can patients pass it to other patients?
That's a good question. I mean, in general, if it's infectious, it will. Like if the patient has the infection that he got, it's actually infectious by nature, that will go. But most of the infections, they are with the patient themselves. So it's very serious for the patient, unless if it's infectious, of course. When I say infectious, that it could be transmitted through air or breathing or touching to other patients. There is some kind of infection that do transfer from patients to patient, or from patients to employee, or from employee to patients. Yeah.
With the survival rates, does it depend on your age, your health?
Well, that's a good question, because there is some people who have high risk than others. So people who are, children are more at risk. People above 75 years of age are more risk. People without spleen or liver, they are more at risk. People who have chronic conditions, they are more at risk. But in general, if you say the survival rate, the survival rate depends on how quick you start treatment, basically.
Okay.
So that's why this day is happening, because we want people to start the treatment quick. So you cannot start the treatment quick without realizing the problem quick and fast.
Oh, thank you very much.
No problem.
Thank you.
Thank you very much.